Hi, I'm Melissa.
Hi, I'm Tyler.
Hi, I'm Jay.
Hi, I'm Jasmine.
And I'm Allison.
Imagine that you are diagnosed with pancreatic cancer. You are 75 years old and have 3 adult children and 4 grandchildren. Your oncologist gave you 6 to 12 months to live. With the help of chemotherapy and surgery, you have lived 2 years beyond your initial diagnosis. You have been admitted to the hospital 3 times in the last month for pain and nausea control. You are now living in a hospice house where the nurses try to keep your pain under control and your family comes to visit you at every opportunity. You have lost 53 pounds and weigh a mere 105 pounds. You are wasting away before everyone's eyes, even your own. Your spouse of 50 years sits at your bedside 18 hours each day, tearful yet trying to be strong. You have declined to a feeding tube placed and are facing death by starvation because you cannot eat. You cannot use the bathroom by yourself and are often incontinent of your urine and bowel movements. When this happens, your spouse or nurse cleans you and reassures you that it's okay. This is the reality for many people in our society. They are faced with the prospect of a long, painful, possibly humiliating death due to disease or condition. This reality should have options that allow patients to demonstrate autonomy that in their own care and disposition. According to the article Legalizing Euthanasia or Assisted Suicide, physician-assisted suicide, also known as PAS, is defined as a situation which a physician subscribes a lethal substance that is then self-administered by an individual. This is quite different than euthanasia, which is described as a scenario in which a physician administers the lethal substance, therefore intentionally ending the life of a person at his or her request. This article also says that PAS is legal in only 2 states in the United States. The 2 states, Oregon and Washington, have both legalized PAS, although euthanasia or assisted suicide is still illegal. The ethics of palliative care tells us that autonomy and patient choice weigh heavily into the argument that supports PAS. We cannot underestimate or dismiss the importance of control by the patient at end of life. Emmanuel's article related to the benefit of legalized PAS discusses the controversy that exists as to whether or not PAS is essential to realizing individual autonomy. He also tells us about limits on autonomy and choice that have been imposed in an effort to protect the larger community, with examples being laws and regulations that restrict individual autonomy for the greater good, including speeding laws and taxes. PAS has failed many attempts at legalization due to the desire to protect the community at large, without considering public opinion. Meyer tells us that the public opinion polls suggest that a majority of people favor legalization of PAS, with many specialty physicians reporting having had patients request PAS, as well as having honored that request. This data justifies a deeper review of this practice, as well as the societal needs and desires. In their article, instead of legalizing PAS, Ahurst discusses the many efforts that have been put into place to improve palliative care services or usage. Emmanuel tells us that PAS is, at best, a way to provide quality dying experience. The fact that pain is a fairly agreed upon concept that has standard measures by which it can be assessed is shared by Emmanuel. He goes on to explain that suffering, on the other hand, is vague and controversial. Emmanuel's article discusses that 2.3 million Americans die each year. He goes on to explain that of these 2.3 million, half occur quickly and without warning, with the other half having a distinct dying phase during which a patient could request PAS. Within this subgroup of patients, many will experience intractable pain on what constitutes unbearable suffering to the patient. Emmanuel asserts that the complexity of patients' perception of what unbearable suffering means to the patient is part of the reason that PAS has been denied for legalization so many times. In addition, the relief of physical pain and suffering PAS would provide benefit in the form of mental reassurance. In contrast to the 1% of terminally ill patients who might benefit from PAS due to physical symptoms, data shared by Emmanuel shows that approximately 40% of Americans might receive physiological reassurance, knowing that PAS were an option in their care if their dying process were to become too painful. Legalization of PAS would require oversight to ensure that those who do not desire PAS are not experiencing it. Lesser explains that it is possible to construct criteria that would make it unlikely that the people who did not want to die were being assisted to die, while providing relief for those who for those that are suffering and cannot be alleviated in any other way. Establishing criteria for PAS would also allow this treatment option to be expanded to provide benefit for those who do not suffer from a terminal disease. While the concept of legalized PAS is complicated, in reality it is not. Suicide, or the attempt to commit suicide, is not illegal in the United States. We do not prosecute those who make an attempt to end their lives. Why then would we prosecute a provider for providing those individuals with the means to end their suffering in a humane way? This question will not be answered anytime soon and will require extensive studying of literature and statistics. If legalized, it will also require regulatory oversight and the creation of policies and procedures to ensure that public safety is protected. Murphy explains that it will be vitally important that the public is protected from any state power related to PAS. That being said, the effort is warranted so that patients are able to make informed decisions related to end of their life, just as they have throughout their life. Thank you.